love and a plan, you knew God had a plan for you when you think Jesus forgot you. So look at the fam you grew, God had a plan for you when you thought Jesus forgot you. Reach for your goal, say what you're told, think that you know.
Today I will be talking about racism and how I deal with racism through my 12-hour shift as a nurse. I've experienced racist people in the other previous healthcare fields that I've worked in, and it's been cool, but I guess till more recently, like, it's been hitting me and I'm like, dang, wow, this is crazy. So I remember first starting out as like a brand new baby nurse. I'm talking like 3 days into orientation, and I had a fairly young orientator. I don't know, the person I was shadowing was a young nurse too. And so it was cool learning from her and learning how to get over that awkwardness of being a new nurse. So we walk into the first patient's room and I'm all like live at 5, I'm popping, like I'm like, hey, I'm gonna be a nurse today, how can I help you? And the patient just automatically just greeted me with the stankest of stank faces. I was like, what's you? What be this? Like, I was really confused. I was like, okay, it's the morning, let me, cut her some slack. So then I come back and, I bring it down a notch, inside voices, and I still feel like, whoa, like she's pissed at me. I don't, you know how you feel something, like, I'm like, something is off. So later on, the doctor comes, makes his rounds, and I hate being in the same room as the doctor because it's like, how are you gonna ask me if the patient is peed when the patient is right in front of you? You ask the patient, like, so the doctor is standing between me and the patient, and so the patient can't see me, I can't see the patient. So the patient is like going ham, and I'm over here like thinking, looking at my sheet, trying to in my head go through all the things I have to get done. So I hear the patient talking. I'm like, boy, she sounds heated. Sheesh. And so then the doctor turns to me and looks at me. I look at the doctor. I'm like, he's looking at me like, fam, is this you? I look at him like, fam, I don't know. And so then luckily I got saved by a phone call. I stepped out and, went about my day. Didn't really think that much about it till the next time I was about to step into the patient's room. The nurse that I was shadowing was like, you know what? To be honest, she's racist. I got you. I'm going to take her. And I was just like, are you serious? Like, I was so like, dang. I was so blown away. I was like, bruh, really? I thought it was, but I want to give people the benefit of the doubt, So for the 3 hours or 2.5 hours that I did have the lady, I can honestly say that I tried to provide her with the very best care. And that's all you can do with patients who don't or show disdain towards you, and it's not anything that you have done per se. So for me, in dealing with racist patients or dealing with any sort of patients in general, first of all, I approach each patient individually and with respect. Now, the way I talk to an elderly gentleman, it depends. Like, maybe I come to this level and talk deeper. It's not the same way I approach a timid, shy, frail little old lady. Two different things and two different approaches. But in totality, whenever I treat my patients, I treat them with the utmost respect and with care, because that could be a family member or someone I love in the opposite, in the opposite place. So I try my best to just treat everybody. No one wants to be in the hospital. Nobody's like, today, yup, this is the day I'm finna chill at the hospital. That's what I'm gonna be doing. No. So it's my job. I feel like it's my duty to make sure that your stay here is as pleasant as it can get. Mind you, you're not going to get that much sleep, but for the most part, I'm going to love on you and just make you, feel welcomed. So in dealing with difficult patients, that's the way you want to approach racist patients. And the patients, just as much as they have the right to refuse your care, if it ever gets that much, you have the right to as well talk to the charge nurse and be like, whoa, okay, I tried my best, but explain the situation. You never want it to go unheard of. So you want to talk to your charge nurse and tell them, hey, this is what's going on, as well as the other nurses. Now, you don't want to be like, hey, patient in room, da-da-da-da-da, and, announce their business, but you just don't want it to come back and be like, hey, that, nurse was rude, or that nurse treated me in such a way, and no one will have no clue. So you always want to voice the way you feel, because at the end of the day, we're all humans and we all need to be treated equally with respect. Another thing dealing with racist patients or difficult patients is the fact that you kind of, as nurses, have to put yourself in the other person's shoe. Okay, so why are they feeling this way, and how can I get them to understand that, yeah, my skin tone may be a different color, I may be of a different background than you, but I can relate to you. You want to make yourself be relatable, so don't take it to heart. And that's something that I'm learning as a new nurse, not to take all these occasions of dealing with difficult patients to heart. Because a lot of times when I walk into a patient's room and they look at me and they're like, this girl's crazy. She got some bluish green hair all up in this thing. She looks like a wild child. She looks young. Like, can you get this child out of here, please? You know, a lot of times I get that, wow, are you sure you're my nurse? I'm like, yeah, I'm old enough. I got you, fam. So I don't take it to heart. You know, it gives me that motivation to be like, I got you, fam. I'm gonna take very good care of you, so that way you be like, whoa, man, okay, I doubted you, but you got the juice. And I'll be like, yes, I got you, thank you. You know, so use every moment or opportunity that you get with a difficult patient to challenge you and to grow your skill set, grow your strengths, so that way when the next situation comes, you know how to handle it. And as a nurse or a nursing student, you just want to make sure that you yourself are giving forth the best. You're given the very best care that you can give. And at the end of the day, that's it. So for those 2.5 hours that I did care for that patient, I was like, all right, it sucks that I got let go as a nurse, shed one baby tear, but it is what it is. I'm not going to dwell on that, and I'm not going to let that ruin my day, because after all, I gave it my best. You get what I'm saying? So I just want to encourage those who are dealing with difficult patients. You're not going to have a perfect shift every shift. That's a anomaly. That's, you must be really blessed if you got a perfect shift 3 times a week, But when you do not, and you have a difficult shift, you take that time to reflect. What could I have done better? What did I do well? And what could I have done better? So that way, you come with a better arsenal for the next shift, the next day, whatever the case may be. But yeah, that was my experience. Real short, sweet, and simple. The new videos dropping every Friday. I'm gonna try to be consistent, and so that's it. Thank you so much for your time. I will see you on Friday. Bye.